فيرتشوال ولا؟ هو فيرتشوال ولا؟
It's not working. Now we have the pleasure to introduce Professor Ahmed Abdelwahed. He's the director of radiology at Saad Kafafi and also the professor of radiology at Misr University for Science and Technology. Thank you for joining us. Have the floor, please. The mic our side is not working. The IT, we need your support, please.
Good morning. My dear professors, my colleagues, really appreciated that amongst you today. As Dr. Flusher talked about photon counting CT angiography, it's a quite complex subject. It's a new technique, so let's dive in. For the photon counting CT, it's an emerging technology. We are really witnessing the breakthrough in the CT technology nowadays. Briefly, photon counting CT uses energy resolving detectors, thereby enabling scanning at multiple energies without the need to use dual energy CT. The current clinical CT systems rely on energy integrating detectors that measure the total X-ray energy. Yet the photon counting detectors, the photon counting CT system, count the exact number of incoming X-ray photons and also measure their energy individually. The current CT technology has substantial limitations. First, the exposure of patient to ionizing radiation. This can be reduced, but it will affect the image quality. Also, the limited ability to differentiate between pathological and healthy tissues. Again, the iodinated contrast agent used in CT can cause kidney damage, and the X-ray attenuation value in CT images are expressed in Hounsfield unit, which are influenced by other factors like tube voltage. Here comes dual energy CT. These limitations can theoretically be solved with the use of dual energy CT. The clinical CT scanners currently use energy integrating detectors. For each detector element, measure the total X-ray energy deposited in the detector during each measurement interval. Here we can see the incident X-ray absorbed into the upper layer, which is scintillator made of material that convert X-ray into visible light. When the X-ray photons strike the scintillator, a shower of secondary visible light photons is generated. These are absorbed by photodiode made of semiconducting material, which measures the amount of incident light and generates an electrical signal proportional to the total energy deposited during measurement. The photon counting detector, on the other hand, do not require these separate layers to convert X-ray into light photons. The moving charges generates an electrical pulse in the wires attached to the electrodes, which is registered with electronic readout circuit into electronic signal. Here we can see that the X-ray photons converted into positive and negative charges without the need to the other extra layers that convert photons into visible light. For this diagram, we can see that the electronic system of the detector counts the number of the pulses with the height that exceeds the preset threshold level. The threshold is set at a level that are higher than the electronic noise level, but still lower than the pulse generated by the incoming photons. Furthermore, by comparing every pulse to several threshold levels, the detector can sort the incoming photons into a number of energy bands, around 2 to 8 usually, depending on their energy. This energy discriminating ability of the PCDs arises at the electrical signal deposited by each X-ray, which is proportional to its energy and can be used in two key ways. Number one, it allows the application of energy-specific thresholding to remove low-energy photons that are a part of electronic noise, and also elimination of the electronic noise will facilitate the development of ultra-low-dose CT protocols for adults and, more importantly, for children. Secondly, the energy discriminating ability of PCBs permit evaluation of spectral information using X-ray tube. Again, multi-energy CT information can be displayed and analyzed similar to dual energy CT, but using photons in different energy bands rather than two exposure from different X-ray tubes as the dual energy CT. For the radiation dose reduction, it's important in the pediatric age group. The discrimination here, the higher spatial resolution and the improved signal to noise ratio will lead to improved visibility of the anatomic structure in smaller patients, with increased dose efficiency facilitating further dose reduction. The dose reduction is around 20 to 30% without sacrificing any of the imaging quality. We can also use 10 filters that can be used to shape the polychromatic X-ray tube energy spectrum, facilitating the high energy photons and eliminating the low energy photons, which will lead to great proportion of photons passed through the patient and facilitating substantial dose reduction. For PCD CT, it allows for improved iodine contrast at the same tube potential compared to EID CT. With the added benefit of multi-energy display and material decomposition, the PCD CT improves iodine signal due to the lack of downweighting of low energy photons which occur with the IED X-rays. For instance, the polychromatic 120 kV PCD images yield image contrast characteristic resembling lower tube potential settings with increased contrast differences. Here is a 70-year-old female with a history of resected intrahepatic cholangiocarcinoma. We can see in the first image the sharper contrast resolution of the depicted vessel, as well as the arrow, the big white arrow. We can see there's a better and sharper resolution at the area of the jejunojejunectomy. With improved iodine signal, improvement in iodine signal with PCD potentially in combination with low energy FMI can alternatively be used to reduce the amount of iodine used to achieve similar differences in image contrast for different diagnostic tasks. Here, a 69-year-old female patient with non-peripheral arterial disease. In the first image, we used 145 milliliters of contrast material, and in the second image, we used just 45 milliliters of contrast material without affecting any of the image quality. There is a pluming artifact that occurs with the calcium. Partial volume averaging attenuation value in voxel with different tissue, making it difficult to resolve objects smaller than the voxel. Calcium pluming is a common artifact in cardiovascular exams due to limited spatial resolution. Here we can see a 74-year-old male patient with non-peripheral arterial disease. The first image was the EID CT and the second image with the PCCT. Here we can see better depiction of the vessel caliper and vessel lumen, allowing proper diagnosis for the degree of stenosis. Here also we can use some algorithms to subtract the calcification from the image. This image with the EID CT with common femoral artery calcification. After using PCCT and calcium reduction algorithm, we remove the calcium from the image for better assessment of the vessel caliper and lumen. Here we have another image for the 3D volume rendering of the coronary arteries. At the PCD image, we can see the proximal coronary arteries is well depicted, as well as the EID CT. Still, we can see the proximal coronary artery well depicted, but for the PCD, we can see the distal coronary arteries much more better than the other EID scanner. Here in this image, in the other image, we can see that the aortic cusp, the commercial non-coronary cusp, and partially and the papillary muscles well more depicted, more visualized than the other EID CT scanner. Again, we can see in the upper images the septal branches of the coronary arteries more better depicted than the other EID CT. Here we can see the soft plaque in the coronary artery that is not well visualized in the EID CT. And again, I can see the coronary artery stent in this image, and I can see the defect in the struts of the coronary stent much more better in the PCCT. Again, I can see the mixed plaques and the calcification with better lumen depiction in the PCD. Again, here we can see the calcification in the coronary artery, the upper image with the PCD and lower image with the EID. You can see the sharp details and delineation of the atheromatous calcification without affecting the lumen and the caliper of the vessel. For the photon counting detector property, the benefit I get from the image is usually the increased iodine signal, as there is no downweighting of the lower energy photons. I get the quantum noise only depicted, reduction of the metal and pluming artifact, reduction of radiation dose, and improved spatial resolution. Thank you.
Thank you, Professor Ahmed. It's our pleasure to have again Professor Karen Knapp, the head of